you don't have to wear a cape to be a superhero? What if I told you you could be someone's superhero if you are 17 years of age or older, in good health, and weigh at least 110 pounds? If you are any of these, you are a candidate for blood donation. According to the American Red Cross, every 2 seconds someone is in need of blood, and about 36,000 units of blood are needed every day. However, society is experiencing a blood shortage because of the blood products cannot be manufactured, and volunteers are our only option for blood donation. With extensive research, personal experience of donating blood, and as a nurse, I see firsthand how serious the need for blood really is. The goal of this speech is to persuade you to become a blood donor by discussing the need for blood, the process of blood donation, and the benefits of blood donation. Imagine you're on your way, driving home from work, and see a flash of 2 bright lights before waking up in the hospital. You found out that you were in a car crash and lost a significant amount of blood, and fortunately the blood bank has enough of your blood type to save your life. Now imagine they did not. How many lives would be lost if we did not have blood donors? Every day, blood and platelets are needed for accident and burn victims, heart surgery, and organ transplant patients, and those receiving treatments for leukemia, cancer, and sickle cell disease. However, according to GivingBlood.org, only 37% of the U.S. population is eligible to donate blood, and less than 10% of the population do annually. Blood is essential for life, as it carries the body's oxygen to organs and tissues. According to the American Red Cross, 1 blood donation is equivalent to 1 pint of blood and could save up to potentially 3 lives. There are 4 main blood types: A, B, AB, and O. Your blood is made up of enzymes and proteins that make up your blood type, which can either be positive or negative. O negative is the universal donor, which means any recipient can receive it. However, some blood types are uncommon and are not compatible with other blood types. The need for all blood types is crucial, but especially O negative. The United States is constantly facing a blood shortage. The reason for the blood shortage is increased demand due to increased complex therapies such as chemotherapy, organ transplants, and heart surgeries. Also, the amount of blood people in need is exceeding the amount of blood being donated. According to USNews.com, Dr. Pam P. Young, Chief Medical Officer of the American Red Cross Biomedical Services, states, "There is an especially increased demand for O-negative blood. It is what emergency personnel reach for in serious situations when there is no time to determine a patient's blood type, for example, in critical and trauma situations." One solution to this problem would be to educate the public on blood donation. The more people know and are educated about blood donation, the more likely they would be to donate. Now that I've discussed the need for blood, I will discuss the process of donating blood. There are a few reasons people don't give blood. According to the University of Maryland Medical Center website, one of the top reasons is that I am too busy. However, the entire blood donation process takes about 1 hour, and the actual blood donation time takes 7 to 10 minutes. The first step would be to seek out a local blood donation center. Registration would go over your eligibility to donate blood, and you will read some information on donating. You will then answer a few short questions about your health history, and your temperature, pulse, and blood pressure and hemoglobin level will be checked. According to the University of Maryland Medical Center website, the next reason people don't give blood is because I don't like or I'm scared of needles. I'm afraid to give blood. Once your vital signs are checked, a nurse will cleanse an area on your arm and insert a new sterile needle for the blood draw, which feels like a quick pinch and is over in seconds. You will be seated or lying comfortably throughout the process. Once a pint of blood is collected, the needle will be removed and discarded, and your arm will be bandaged. The University of Maryland Medical Center includes additional reasons people don't give blood, which includes: no one ever asked me, I didn't realize my blood was needed, my blood type isn't the right type, they don't want my blood, I'm too old or have an illness, I have a rare blood type, so I'll wait until there's a special need. I'm afraid I will get AIDS. I don't want to feel weak afterward. I already gave this year, or I don't have any blood to spare. The reality is, all blood is needed, and there is a constant need for all blood types, especially rare or special blood, since it is in short supply. You are never too old to donate, and most medical conditions do not prevent you from donating blood. A blood donor can give every 56 days, that's 5 times a year, or 15 lives a year. It is not possible to get AIDS by donating blood. A sterile needle is used for each donor. Lastly, according to the University of Maryland Medical Center, the average adult has 10 to 12 pints of blood, one of which will be taken during donation. Your body is constantly making new blood and naturally will replace the fluid within 24 hours, and most people continue their normal activities after donating. After donating blood, you are provided with snacks and refreshments. You are required to wait a few minutes before discharge, in which a nurse will check your pulse and blood pressure again before you are able to leave. Blood donation centers sometimes provide patients with incentive gift cards or gifts such as t-shirts similar to the one I'm wearing today, movie tickets, or gift cards. Now that I've discussed the process of blood donation, I will discuss some health benefits of donating blood. Blood donation has many positive mental and physical benefits. According to the American Journal of Epidemiology, studies have shown that by donating blood, 88% of people are less likely to suffer a heart attack and 33% less likely to suffer cardiovascular events. According to oneblood.org, Medical Director Dr. Richard Gammond, MD, writes, "There have been studies published to show that blood donors enjoy better health, and blood donation reduces blood pressure and cholesterol. High blood pressure is one of the leading risk factors for heart attacks. By donating blood, this will help improve blood flow and reduce arterial blockages. High iron stores also increase the risk of heart attacks. When you donate blood, it depletes your iron stores and forces your body to make new blood. Blood donors receive health checkups every time they donate. Blood pressure, pulse, temperature, iron, and cholesterol levels are checked, which can reveal early undetected health issues. Lastly, donating blood can help improve your mental health. Volunteering has been shown to have positive effects on happiness, allowing the donor to feel accomplished and a sense of satisfaction knowing they have done something to make a difference. I hope this speech has made you realize the importance and need for blood donation. All blood types are needed, and every donor is important. If you stop to think about that small hour of time it takes for you to donate blood, that could mean a lifetime for that premature baby, someone undergoing cancer, chemotherapy treatments, or someone who is in a life-threatening accident. And remember, you don't have to wear a cape to be a superhero.